Positive deviants are individuals whose uncommon behaviors lead to their success against all odds. This is the story of Ed Roberts, positive deviant with a disability. Ed Roberts, the father of the independent living movement, which tore down barriers for individuals with disabilities to full inclusion in their communities, was born in 1939. Ed lived the first 14 years of his life without a disability. In 1953, he contracted polio and experienced a high fever. Within 24 hours, Ed was paralyzed from the neck down. Ed's paralysis impacted his ability to breathe, and he had to use an iron lung. Philip Drinker and Louis Shaw of Harvard School of Public Health developed the first widely used iron lung, or negative pressure ventilator, in 1928. Although originally developed to treat individuals with coal gas poisoning, the iron lung was most famously used for the treatment of respiratory failure caused by poliomyelitis, or polio. Although crucial in the treatment of polio at the time, the machines were very heavy, weighing nearly a ton, and therefore restricted polio patients' ability to engage with their communities. While laying in his iron lung, records reflect that Ed recalls an early conversation between his mother and doctor. His mother asked the doctor if he would die. Within earshot of Ed, the doctor replied that she'd rather he die than be a vegetable. Imagine the psychological impact that this would have on a 14-year-old boy new to the experience of disability. What was the significance of this comment for Ed? He decided that he would indeed become a vegetable, an artichoke in fact. He would be prickly on the outside to fight the fight that was needed for the rights of people with disabilities, and soft on the inside with compassion for those who struggled with him in this fight. Ed taught himself to breathe outside the iron lung using a method called frog breathing, which involved swallowing air into his lungs. This technique itself represents a sort of positively deviant, or PD, behavior. It was discovered by Dr. Clarence W. Dale at Los Angeles' Rancho Los Amigos Hospital. Dr. Dale noticed that one of the young men he was treating who had polio, leaving his breathing muscles almost completely paralyzed, had developed a substitute way of breathing. Noting the significance of this behavior for individuals with paralysis that impacted their breathing, Dr. Dale and a colleague, Dr. John Felt, worked with their PD patient to teach the technique called glossopharyngeal, or frog breathing, to other patients. In 1951, Dr. Dale published an article in California Medicine titled Glossopharyngeal Breathing by Paralyzed Patients, a Preliminary Report. Dr. Dale wrote, "Very similar to lung breathing used in most amphibian, including frogs and toads, frog breathing consists of trapping a small amount of air in the mouth and throat and then forcing it through the larynx by action of the tongue and pharynx and sometimes of the cheeks. The air is then held in the lungs by closure of the larynx, while the mouth and pharynx are again filled with air, which again is forced into the lungs. This is repeated about a dozen times until the lungs are quite filled. The air in the lungs is then emptied, usually through partly closed lips. This is repeated continuously with a respiratory rate of about 6 per minute. The terms glossopharyngeal breathing and frog breathing seem quite appropriate for brief description. Several of the patients discovered this method of breathing without help or even suggestion that it was possible. Others learned from them. Several of the patients who breathe in this manner are now able to be out of the respirator for several hours. They can be placed on a regular bed, which facilitates nursing care, physical therapy, and occupation, and improves their morale. They are able to talk much louder and longer on one breath, and they are better able to cough out mucus." A later publication in the Journal of the American Medical Association, JAMA, documented the use of frog breathing with 100 post-poliomyelitic patients. Clearly, this solution to paralysis of the lungs, starting with one positively deviant patient, was promoted and successfully adopted by many experiencing similar effects from polio, enabling them to live less restricted lives against the odds. Like the 100 patients in the study reported in JAMA, mastery of this breathing method gave Ed Roberts the freedom to spend increasing amounts of time outside of his iron lung, the freedom he needed to be able to go to school. He completed high school and set his sights on attending college at the University of California at Berkeley. When Ed first spoke with the Berkeley administration, he was told, "We tried cripples, and they don't work here." He sued the school and won. However, this was not the end of his hurdles. When he arrived on campus, he found that Berkeley was completely inaccessible to people with disabilities. Ed lived in a hospital ward on the edge of campus that would accommodate his 800-pound iron lung. He still needed the machine to sleep and rest. He engaged in protests with other students with disabilities who began to arrive to campus. Ironically, he did not fear arrest because the jails and police cars were not accessible, so there was no way to get him to jail. Ed and his friends at Berkeley, including Hal Zukas, a gentleman with severe cerebral palsy who used a head pointer to drive his wheelchair and had a speech impairment, formed a group on campus called the Rolling Quads. Realizing that they could harness the power of disability to use in their fight for equal rights, they met with Governor Reagan to discuss their agenda. They placed Hal on one side of Reagan and a beautiful woman with paraplegia on the other. When Reagan saw Hal, his appearance caused him great discomfort, and he clung to the woman with paraplegia. The women proceeded to lay out their agenda to the governor, effectively getting their voice and issues heard. Ed Roberts and the Rolling Quads and the disability rights activists founded the Berkeley Center for Independent Living, the first independent living service run by and for individuals with disabilities in 1972. Today, there are centers for independent living in every state across the nation, advocating daily for the rights of individuals with disabilities to lead lives of maximal independence fully included in their community. Ed Roberts died in 1995 at the age of 56, but his legacy lives on. People with disabilities and rehabilitation practitioners internationally know Ed Roberts as the father of the independent living movement. Ed is a remarkable example of a positive deviant. Whether it is reclaiming the label of the artichoke, breathing like an amphibian, or harnessing the power of disability to negotiate with congressmen, PDs throughout the history of rehabilitation have revolutionized the industry, bringing it to where it is today. Centers for independent living are no longer rarities, and accessibility is a term familiar to most people. The story of Ed Roberts illustrates how the uncommon behaviors of positively deviant individuals may be amplified, leading to future innovations benefiting the lives of individuals with disabilities.